Hi, welcome back to Rohrich Knows Podcast, helping you become a better and more informed you about all things about aesthetic surgery and wellness. I want to thank all of my viewers on YouTube and on my podcast for listening and sharing my podcast and writing me DMs and emails about how much you've enjoyed them and what you've learned, because my goal is to help you understand what you're going to be getting into if you're doing something related to wellness or plastic surgery, just to be safe and be better informed. Today, let's talk about lip lifting. It's a very hot topic. You know, it seems like every time we talk about something like lips and lip fillers, we're talking about lip lifting. And I'm going to talk to you about when is a lip lift indicated and when it's not. So, you know, as we age, you know, our lips tend to get thinner and longer, and I think that's really important to understand. And, you know, a youthful lip has, you know, is a ratio of the upper lip to the lower lip of 1 to 1.6, because the lower lip is fuller. And really an upper lip is about 70% of the volume of the lower lip. And the upper lip, you know, protrudes a little bit more than the lower lip, but the lower lip is fuller. So as we age, as you can see, from age 20 to age 70, our lip gets longer and thinner, and it also goes downward more. And so lip lifting are a key integral part of central facial rejuvenation. And there's a recent article that we wrote about this that talks about this. And as we age, it's not just the lip that ages, it's that the bone behind it, and the lip gets thinner, and you get subsequently further volume loss, and it gets longer. So, and they've shown that in the aging of the upper lip, you know, that the lip length centrally lengthens more than that laterally. And so your lip centrally has a lot more powerful lengthening than that of the lateral lip. So that's the part that really that goes first. So patient selection is so critical in this. And I will tell you that in the aging lip, you can see that as you get older, your central lip gets longer. So patients to avoid: young lips, normal lip length, adequate vermilion fullness. Don't do a lip lift on these. Or a patient like this that, you know, wants to come in and have not only more filler but also a lip lift. I mean, that's ridiculous, because, you know, first of all, if you have significant lip filler, it blunts the anatomy. So it makes it very unpredictable to see really what kind of lip lift, if any, you should ever do. And certainly a patient like this, you shouldn't do it. You should dissolve the filler before you consider doing an upper lip lift, but this is not a patient you're going to do it on. And patient selection is very important, because if you do a lip lift on a young patient, you'll get a lot more scarring, and it's not reversible. And I tell you, that's really incredibly important to know. And that scar will not age well. So there's a central lip to do, which is just between the alar bases, and there's one that goes extended outward. And I'm going to talk about and show you exactly what I mean by that. And so here's one that's a central lip lift for younger patients with central lip excess. And so you can plot out exactly what you're going to do. And there's one, then an older one, which extends up, and it's called a bullhorn type of lift. And that's the one that you can do more commonly in the facelift patient. So we can see that, and then the markings are done preoperatively and intraoperatively confirmed, and you can really size exactly what you're going to talk about. And it's really not what you take, but what you leave behind, you know, leaving 11 to 13 millimeters centrally, 15 to 17 millimeters laterally, as you can see here. And those lateral markings shouldn't go above the mid portion of the ala. And then they're excised full thickness, and then you can do some subcutaneous undermining of the SMAS to bring it up and hold it into place. And of course, doing a lip procedure is an operative procedure, so it should be done in a sterile procedure. I actually like to do them under general. Sometimes we do them under local, but here's a patient that has a central lip lift. She's a year post-op, and you can see it's been quite dramatic, just subtle changes in her fullness in her lip and shaping and contour. It really makes it look better and softer and more youthful. And I think that's really what you want. And an extended lip lift is really more involved, and is a patient like you can see here that has really a long lip centrally as well as laterally, so you do the bullhorn type lift. And this is a lip lift that's done, and this was actually done in the office on one of my patients, and it just shows, this briefly shows the markings, and we're gonna do this under local, and we show the markings centrally at 11 to 12 millimeters. Then we mark them out, and we do that very gently, and then we'll do the lower lip. We prep the area. We've already done local in the area, and then we'll incise it, and we'll really remove that redundant skin all the way around to the front and the side, and take it off, and then do meticulous dissection, and then we'll actually elevate the SMAS and then close it very meticulously in this area. You can see where we've closed it front and the center and laterally, and really shaped it and done a beautiful job and did really restored. This is all done under local, and you can see in this patient we're closing it, and you can see the shaping of it, and you can already see how beautiful her shape and contour is. Here it is at the end, and you can then also see how she looks when she's come back to see me, and here she is afterwards, and then you can see her shape and contour is better. Here she is about 10 days post-op, and then of course you can see her again later, and you can see how great it looks, and it really, you can see that her shape and contour at a month is phenomenal. So here she is pre, and here she is post, and you can see how great she looks. She's several months post-op. You can see her lip shape and contour is better. Her scar is almost imperceptible, and it really looks great. And so here's her before and after. And you can see here's another patient that has had something similar in shape and contour. And you can see that she's had a facial rejuvenation with it as well. And it just gives you a nice balanced look to her face. So lip lifts are very important, and are if done in the right patient, in the right setting, are game changers. You can see another extended lip lift in patients that really gives them a more youthful look from that aging of the central part of the face. So you can see that you really, with a small incision along with doing facial rejuvenation, can really change these patients tremendously. So in conclusion, it is truly a missing link. It's a great adjunct for facial rejuvenation. So be conservative, respect the nostril sill, meticulous incision placement and delivery and closure. And then volumizing that area and with texture restoration is also critical. So know before you go, and hopefully these were very important concepts about lip lifting and have helpful in finding whether you need a lip lift or not, or would benefit more from a filler. But most importantly, find a board-certified plastic surgeon that understands the power of lip lifting and how to do it properly, and make sure that you get the best result in a seamless manner. So leave me your comments. In any way you'd like, DM me on my social media or on my YouTube channel, and hopefully this will help you become a more informed and better informed you about lip lifting. Until next time.